Excellency Review Center. Normal OB. Most favorable and common fetal position. Answer: LOA. Labor longer and harder. More back pain. Head must take a 180 degrees turn pressing against the bony sacrum in the process. Answer: LOP and ROP. Most frequent presentation, 95%. Answer: cephalic. Causes cervical dilatation. Answer: uterine contraction. Irregular, intermittent contraction that have occurred throughout the pregnancy become uncomfortable and produce a drawing pain in the abdomen and groin. Answer: Braxton Hicks contraction. Next, occurs when newborn's head or presenting part appears at the vaginal opening. Answer: crowning. Next, placenta separates first at its center and lastly at its edges. Tends to fold on itself like an umbrella. Fetal surface presentation, appearing shiny and glistening from fetal membranes. Answer: Schultz. Hollow muscular membranous canal located posterior to the bladder and anterior to the rectum. Answer: vagina. Small 1 to 2 cm rounded organ of erectile tissue at the forward junction of the labia minora. Answer: clitoris. Healing of torn hymen, carunculae mystiform. Muscular structure easily stretched during childbirth to allow enlargement of the vagina and passage of fetal head. Answer: perineum. Middle layer, largest part of the uterus. Muscle layer for delivery process. Answer: myometrium. Outer third or second half site of fertilization, longest 5 cm. Answer: ampulla. Site of maturation of sperm. Answer: epididymis. Semen derives from the following: prostate gland. What percent? Answer: 60%. The only period present in males where he cannot be restimulated for about 10 to 15 minutes. Answer: refractory period. Causes ovulation. Answer: upsurge of luteinizing hormone. Felt and observed by the mother but does not confirm positive diagnosis of pregnancy. It is subjective. Answer: presumptive. Signals that a woman is nearing ovulation or is ovulating. Cervical mucus is thin, watery, and transparent, abundant, and highly stretchable. Can determine through ferning. The answer: Spink Barkate. Yellow body produce yellowish fluid called lutein. Answer: corpus luteum. Hormone produced by ovary contribute to the decreased gastric motility. Answer: relaxin. Burning sensation along the esophagus caused by the regurgitation of gastric contents into the lower esophagus. Answer: heartburn. Increased salivation formation or local response to increased estrogen. Answer: hyperthyroidism. Increase in circulation changes the color of the vaginal walls from normal light pink to deep violet. Answer: Chadwick's. Change of consistency of cervix. Cervix, softening of cervix. Answer: Goddels. 16 to 20 week lower uterine segment is tapped sharply by lower hand. The fetus can be felt to bounce or rise. Answer: ballotment. Change of consistency or softening of isthmus, the lower uterine segment. Answer: H. Hagars. Awkward walking due to relaxation causes softening of joints and bones. Answer: Waddling. Waddling gait. Next, pink or reddish streak are due to stretching of abdominal wall plus possibly increased adrenal cortex activity cause rupture and atrophy of small segments of connective layer of the skin. Answer: Striae gravidarum. Fertilization to implantation. Answer: Zygote. Or mulberry-like ball with 16 to 50 cells, 4 days free floating and multiplication. Answer: Morolla. Part of the endometrium located under fetus. Portion where the trophoblast cells are establishing communication with maternal of blood vessels. Answer: Base or basalis. Ability of sperm to release proteolytic enzyme or hyaluronidase to penetrate corona radiata and zona pellucida. Antibody antigen reaction. Answer: Capacitation. Layer protects fetus against syphilis, present as early as 12 days gestation, disappear between 20 to 24 weeks, or after 24 weeks critical might get infected with syphilis. Answer: Langhans layer or the inner layer. Responsible production of placental hormone, HCG or human placental lactogen, HPL, estrogen, and progesterone. Answer: Syncytial layer or the outer layer. Forms beneath the chorion produces phospholipids that initiate formation of prostaglandins for uterine contraction. Answer: Amnion. Gelatinous mucopolysaccharide gives bulk of the cord body and prevents pressure on vein and arteries that pass through it. Answer: Wharton's jelly. Less than 300 ml of amniotic fluid, ultrasound will show no pocket larger than 1 cm. Suspect for disturbance in kidney function. Answer: Oligohydramnios. Fine downy hair, lanugo is present. Output like urine is present in amniotic fluid. Ultrasound shows sex differentiation. Answer: Fourth month. Strengthen the pubococcygeal muscles and lead to increased sexual enjoyment because of tightened vaginal muscles. What exercise? Answer: Kegel's exercise. Relieve backache by making spine more flexible. Answer: Pelvic exercise. Decrease the baseline fetal heart rate to less than 100 beats per minute. Answer: Bradycardia. Are transitory decreases in fetal heart rate caused by umbilical cord compression? Answer: Variable deceleration. Next, are transitory decreases in heart rate caused by uteroplacental insufficiency, a compromised blood flow of the baby that does not deliver the amount of oxygen needed to withstand the stress of labor? Answer: Late deceleration. Next, the fetal heart rate will normally remain steady or accelerate during uterine contractions. Answer: Acceleration. If paper turns to blank, the collected sample urine or vaginal secretion is acidic. Turns to yellow. If paper turns to blank, collected sample is amniotic fluid or alkaline, pH 6.5. The answer is blue-green or deep blue. Adding 7 days to the date and counting back 3 months. Answer: Nagel's rule. Used to estimate fetal growth, AUG, and EDC, distance from the top of uterine fundus to the notch of the symphysis pubis. Answer: McDonald's roll. Presents or represents preterm deliveries 20 to less than 37 completed weeks. In TPAL, the answer is P. Woman who is or has been pregnant regardless of pregnancy outcome. Answer: gravida. Refers to the past pregnancies that have reached viability. Viability, para. Systematically observing and palpating the abdomen to determine fetal presentation and position. Answer: LM, or Leopold's maneuver. Instruct the mother to empty her blank to promote comfort. Answer: bladder. Position the mother blank position to relax abdominal muscle. Answer: dorsal recumbent. Then place small pillow or rolled towel under one-sided to prevent blank. Answer: supine hypotension. Wash your hands using blank because warm aids in client comfort and prevent tightening or a warm water. Next, first maneuver, also known as blank pondal grip. Second maneuver, answer: umbilical grip. Third maneuver, or grasp that lower portion of the abdomen just above the symphysis pubis between the thumb and index finger. Answer: Paulic grip. Typical female pelvis, rounded inlet, transverse diameter larger than anterior-posterior diameter. Answer: gynecoid. Flat, female type pelvis with transverse oval inlet, oval or kidney shape. The answer: platypeloid. Junction of the innominate bones at the front of the pelvis. Answer: symphysis pubis. Division of pelvis. Blank support the uterus during the late months of pregnancy and aids in directing the fetus into the true pelvis for birth. Answer: superior half or false pelvis. Forms the passageway of the fetus during labor. Consists of inlet or pelvic brim, pelvic canal, and outlet. Answer: true pelvis or the inferior half. Imaginary line that divide the false and true pelvis, drawn from sacral prominence at the back of the pelvis to the superior aspect of the symphysis pubis at the front of the pelvis. Answer: linea terminalis. Joins the two parietal bones of the skull. Answer: sagittal suture. Found at the junction of the main suture lines compressed during birth to aid in molding of the head. Answer: fontanelles. Narrowest diameter, approximately 9.5 cm, inferior aspect of the occiput to the center of anterior fontanelle. Answer: suboccipitobregmatic diameter. Next, approximately 9.25 cm must be presented to the maternal transverse diameter. Answer: biparietal diameter. A ring or normal physiologic retraction ring may become prominent and observable as an abdominal indentation, fetus larger than birth canal, or danger sign signifies impending rupture of the lower uterine segment. Answer: pathologic ring or the bundle's ring. According to Rubin's phase of postpartum, 1 to 2 days after delivery, time of reflection for woman is passive, letting other people do things for her and make decisions for her. Answer: taking in. 2 to 4 days, the phase where the woman begins to initiate action herself, shows a great interest on caring for the baby? Answer, taking hold. The last, according to Ruben, is letting go at the house or home. Next is the drug of choice for PIH or relaxes the arterioles and stimulates cardiac output via direct peripheral vasodilation. Answer, apresolin or hydralazine. Premature separation of a normally implanted placenta from the uterus after 20 weeks gestation. Answer, abruptio placenta. This is Excellency Review Center.
Please like and subscribe. Thank you.